Hi, this is Scott Korb with Vita Massage. I'd like to share a story about kinesio taping and how it helped my good friend Bob Wilson. So tell me, you had open heart surgery when?
June 1st, 2018, just
Okay.
10 weeks ago.
And you called me up to tape your bruises.
But I was home from the hospital about 2 days and I was having pain in both arms from the bruising from the missed shots and the subsequent blood draws. So I wanted the bruises to go away, and since you had done it when I tore my tricep, I thought maybe it would work for that too.
Cool. And so when I came over and I taped your arms for you, and I turned around and I looked down at your legs and I said, Bob, I can help you with those lower legs of yours. I can see how swollen they are.
Mm-hmm.
And you're like, show me.
Do it.
So after I taped the first leg, and I was getting ready to go to the second leg, you're like, oh my God, I could already feel the difference.
Yeah, I could feel the blood flow and the color change. They went from cold to warm and from white to red.
Interesting. And then I think it was the second visit that I saw you,
Mm-hmm.
you mentioned something about not having much strength in your hands,
Mm-hmm.
and wanted to know if there was a taping that I could do to help because of the way that they set you up on the surgical table.
And where they pulled my shoulders.
Right. And so I did a manual glide on Bob's front to actually bring his shoulders back like this, and over a period of time, that did help you with your strength.
Right. Well, I couldn't even lift my hands over my head. So there was real pressure. And that pressure went away in, I would say, 3 or 4 days.
Interesting. And so the taping changed for you quite a bit as I was working on different things. All we had to we got the pressure off the legs itself, and then I put the tape down on your feet,
Mm-hmm.
and that actually drew more up as well.
Yeah. Well, one of the big things with heart surgery is becoming ambulatory. And I couldn't because I couldn't put pressure on my legs, and I couldn't get up because I couldn't put pressure on my arms. So I was in a lounge chair and couldn't push myself up to get on my feet, and when I did, it hurt. So in less than a week, both of those things were to the point where I could get in and out of the chair without assistance, without fear of falling. And within 3 weeks, I could put shoes on and go back to work. And the shoes on is really critical because when I got home, I couldn't put on Crocs with a shoehorn, and they were a size too big. So the significance is in a week I could put shoes on. In 3 weeks, I could put on regular shoes and walk out and go to work.
And your girlfriend is a nurse practitioner, and she's looking like, I know something's happening here, but I'm not quite sure exactly what's happening, but I see that you're up and walking around, and I can see that you're doing things that most people don't do so quickly after open heart surgery.
Yeah.
I remember being here when your home nurse came, and she's like, you're getting better faster than a lot of people that I know.
Mm-hmm.
It just, is that the tape helping you? And you're like, yes. And how long was it actually that you were?
Home health was only here 4 times.
Okay.
Because my recovery was so fast that there was no reason for them to come back. There was just no purpose. I truncated the use of Lasix, which is extremely difficult for your system, and I was able to do that with the end of 1 prescription, never got it refilled. So I never had to take Lasix, and lots of people take Lasix literally for months to get the fluid out of your system, because when your heart is impaired, the fluid collects in your lower extremities, not only blood but water, all the fluids, and that didn't happen.
Wow, so you were back to work in how many days?
22.
22 days back to work.
From a 4-way bypass, so it's not just heart surgery. It wasn't a cath, it was an open chest.
Amazing.
4-way bypass. And then the other really significant thing is they took one of the arteries for the transfer out of my left chest, and it hurt like crazy. And one of the things I was having trouble with was breathing because of the pain, muscle pain from where they took that artery. And taping alleviated that to the point where it was much easier.
Awesome. Thank you.